It's 11 a.m. here in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. We're going to go into the briefing room now, where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. He will be filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making in order to contain the virus, especially with the spurt of cluster infection cases and imported cases recently at the ports. So we will be bringing you a live coverage of this briefing, which is soon going to begin here in Sejong Government Complex, and Yoon Tae-ho has taken to the podium and it looks like the briefing's going to start.
Let us now begin our regular briefing for August 10th, Monday. As of today midnight, we have a total of 17 new local infections and 11 new imported cases. As of today midnight, the total number of confirmed cases now stands at 14,626, while 663 3 people are in quarantine undergoing treatment. We had no additional fatality and the death toll stands at 305. We have seen a stabilizing situation of the COVID-19 here in the country, and from the 26th of July to the 8th of August, we did an analysis for the 2 weeks, and the average daily new cases in the domestic cases was 12.1, which is about 7.8 cases lower than the previous 2 weeks. And also the percentage of cases managed under infectious disease prevention and control is less over at the 80%. However, we are continuously witnessing the cluster infections, especially in the metropolitan area, centering around churches, religious centers, and cafes and restaurants. In most of the cases, they did not wear masks properly, and they also had dining together at enclosed spaces. And especially for churches, after we have eased the ban on the small group meetings, we have seen an increase in the sporadic outbreaks that have been stemming from the churches to daycare centers and also the vendors at a traditional market. And already many large-scale churches and the religious centers nationwide are cooperating in the government's quarantine measures. However, in small-scale churches, we are seeing repeated cases of dining together, and especially we ask you to refrain from eating together and always wear face masks at indoors, at churches, at all times. Meanwhile, on a global level, against the COVID-19 growth, we are also intensifying our quarantine with the list of countries subject to tougher quarantine measures. And the average of new imported cases stood at 21.4, which is 10 cases lower than the previous 2 weeks. However, we are seeing a rebound in the number of cases by region and especially by countries, and therefore we are calling for the need to have swift response measures. And we have seen a large increase in the number of cases in the Vietnam, Da Nang, as well as other cities and provinces in China, and therefore we have restricted the entry of the Korean businessmen to these areas. And going forward, we will be monitoring the global situation and take appropriate measures. Currently, we have 663 people in quarantine undergoing treatment, and they also we still have a very insufficient amount of hospital beds at at the treatment centers, especially with about 1,100 hospital beds nationwide. And especially we have seen a surge in the number of cases, and the fatality rate during the months of April to July decreased significantly, and this was because of the efficient use of the medical supplies and the equipment for the patients with severe or critical conditions. And also we also had our accumulated know-how in treating these patients. To this end, we would like to extend our deepest appreciation to all of the medical staff members. And overall, the COVID-19 situation and treatment here in South Korea is stabilizing. However, the summer holidays and the summer vacation, we also see an increase of the number of foot traffic. And also, during the monsoon season, we also believe that many people will go indoors. And taking the consideration of the global cases, we will still have risks of infection going forward. And this is why we continue to ask the members of the public to abide by the quarantine measures. And next is the increase of the spectators for these sports events. And last week, we have announced a measure to welcome the spectators at professional sports events while maintaining the capacity to about 10%. And starting from tomorrow, as for baseball, and starting from Friday, 14th of April, for football, we will expand the capacity of the spectators to about 40%. And until the day we have striking a balance between the routine daily lives and the quarantine measures, we ask you to also refrain from continue to wear your face mask and keep a distance, and also refrain from consuming food while you are at stadiums. And the central government will also cooperate with the local governments as well as professional sports teams, and we will make sure that these quarantine protocols are abided by on the ground. Recently, nationwide, we have seen a heavy downpour, torrential downpour, and we are also in a light of the risks of other infectious diseases like waterborne and foodborne diseases. And to this end, we are decreasing the capacity of the number of people at the temporary shelter places, and we are making sure that these shelters abide by the quarantine measures. And especially in the Jeollanam-do province at Gure County, we have dispatched our teams of epidemiological investigators so they can look into the COVID-19 cases there. And also we have high risks of waterborne and foodborne infectious diseases like EHEC as well as typhoid fever. And we continue to ask you to take particular precautions. And we ask you to eat only well-cooked food as well as bottled and packaged water as well. And when you are working at these places, make sure that you are prone to the risks of infection of eye diseases as well as skin diseases, and therefore you need to always wear long sleeves gloves as well as long boots, and you need to wash your hands thoroughly with running water. And when you have symptoms like fever or other symptoms, you need to contact the public health centers as well as the screening centers. And with the COVID-19 doubling with the challenges of the downpour, we believe that many of our members of the public are facing increased fatigue as well as a large depression. And starting from yesterday, we have been announcing our measures to consult psychologically with these members of the public who are feeling depressed. And we continue to ask you to utilize our self-diagnostic application so that you could recover very soon. And the government will continue to stand by the members of the public to provide more in-depth support to this end. During the past 7 months or so, the public and the government has stood side by side overcoming the COVID-19 pandemic. And going forward, we will also overcome the diseases and the disaster going forward, and we will take utmost efforts. Thank you very much.
That was public health official Yoon Tae-oh updating us on the COVID-19 situation in Korea. He just told us that there were 28 additional infection cases of COVID-19, bringing the accumulated total to 14,626. There were no additional deaths, however, meaning that the death toll stands at 305. Well, that wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.